Everyone, welcome back to Danji H, and my name is Anita as usual. Today we will be talking about the systematic examination of the newborn, which most people call it SEN or SEN, but this station focuses on four things. So we have systematic examination of the newborn plus the Nipe. Reason why I'm saying four things is that the Nipe is categorically four parts of the newborn that needs examination or screening tester. So we have the eyes, we have the heart, we have the hips, and we have the testes in males. So when you are given the scenario to perform your link station, you are asked to either focus on the eyes, focus on the heart, focus on the hip, or focus on the testes. So we are going to categorically divide this into four. We have a part 1, 2, 3, 4, and it's going to talk about the eyes, what is expected of you to say when they say do the examination of the newborn and focus on the eyes. And we are also going to talk about the heart, what is expected of you to verbalize to the examiner and to the patient, the hips, and the testes. The newborn examination is very detailed, so I hope these categories is going to help everyone or anyone interested in the midwifery Osce to have a better understanding of what is expected of them. The stressful aspect is that before you prepare for your examination, you may not know which part they're going to ask you to focus on, so it's expected of you to know each and every one of them. It's very tricky, but I know we're gonna get there. Today with me I have a dummy, which is my daughter's dummy. We will be using it for some of the maneuvers of the newborn, so we are going to use this as the newborn, and I hope it helps, which I know is going to help. Well, we are all midwives. We've done these maneuvers before, so as I do them, I know some of you are just going to understand it and interpret it based on how you do it. Probably you can just do it on your newborn when you're doing your examination during your practice before you have your actual examination done. I hope you enjoyed this station as well, and please share the videos for us. See you. So usually I think back in our home countries, when we ask you to do the newborn examination, we tend to focus, like we do the head, the neck, the chest, the hands, the extremities, and the pelvis, and all those things, the back, and we also focus on the reflexes and all those things. Should I say pretty much the same? That's what we are going to do for the systematic examination of the newborn. However, there's been an addition, that is the NHS policy, or should I say the UK policy for newborn examination, is called the Nipe. So the Nipe is newborn and infant physical examination, and it focuses on four areas of the newborn, which is the eyes, the heart, the hip, and the testes. The examiner is going to ask you to focus on one of these to add up to your systematic examination. When the examiner asks you to focus on one of these, what is the examiner trying to say? If she tells you that, tell me something about the heart, or focus on the heart, what is expected of you to communicate to the examiner and to your patient? And this is what we're going to talk about. So today we are going to talk about the eyes. It's one of the easiest. There are just some few bits, and I have already categorized it to become something very simple. Like we will just talk about it. Yes, so during your examination, when you are asked to focus on the eyes, or either of them, but I'm focusing on the eyes, when you're asked to focus on the eyes, what are you going to tell your examiner and the patient? What comes in mind? I know sometimes due to a lot of communication, because it's a link station, you probably have done the postnatal examination first, and you are all stressed out. You are trying to catch up with time and all those things. So how do you focus on when they tell you that tell me something about the eyes or focus about the eyes, what comes in mind? How are you going to put this? So I have actually also categorized into 4 things that helps you. So we have the what is the screening test about, or what is the examination about? When do we do the examination? How is the examination done? And what if? So what if is a positive screening test? What are you going to do? What if it's a negative screening test? What are you going to do? So when we ask you what, I'm going to tell them that, or what it is that the screening test is to identify and refer all newborns born with congenital abnormalities of the eyes. And this is to reduce morbidity and mortality of newborns born with congenital abnormality. So this time you are being asked to focus on the eyes, so then I tailor my explanation to the eyes. So I say it is to identify and refer all newborns born with congenital abnormalities of the eyes, and is to help reduce morbidity and mortality. I hope this makes sense. Very simple. So that is what the what talks about. When they say when, not even when they say when. Let's now move on to the when. So when we talk about when, that is going to focus on when the examination is done. So the first 72 hours of the newborn's life and 6 to 8 weeks is being repeated by the GP. Usually before most patients are discharged, the newborn examination is done for the babies before they are discharged, and repeated again 6 to 8 weeks by the GP, because then they are going to be an outpatient. So they have the review done by their GP, and the GP repeats the examination for them. Let's move on to the how. And this is the biggest part, because how are you going to do the examination for the baby? What goes into it? What are you looking out for? Now, how the examination is done is actually to identify congenital cataract. And how do you identify congenital cataract? The most important thing is looking out for the red reflex in the newborn. So the red reflex, usually when you take a picture at night, I don't know if all of us can tell, when usually you can just use your phone, just try to take a picture at night, you realize that it emits a red thing on the eye, which is shown on the screen, just to help you identify what we refer to as a red reflex. Usually we use the ophthalmoscope to check for the red reflex, and when that is done, it's just like a brown light as shown on the screen, and it's just shown on baby's eyes to detect if the red reflex is there or not, if there is a partial red reflex, and if there is no reflex at all. That is what is mainly focused on. Not just that, how is also the examination done? It's going to focus on the symmetry of the eyes, the color of the eyes, if there is any discharges, if there is any abnormality, anything deviating from the normal. Even if it's a suspicion, that is what is considered abnormal. One is going to ask, when I identify anything abnormal, what do I do next? And that is what if. So if there is a negative screening test, as I mentioned earlier, is supposed to be repeated again 6 to 8 weeks by the GP. However, if it is a positive screening test, then there needs to be a referral to the senior pediatrician within 2 weeks. And usually there should be, the pediatrician should have in-depth knowledge in ophthalmology, or straight up to the ophthalmologist. I hope this makes sense. This is very simple. Now, this is just a communication of what should come in mind when you are being asked to focus on the eyes. So then you ask yourself, okay, now I know about the eyes, what am I going to do next? You have to now add this information to your usual systematic examination of the newborn. we are going to use the Osce by the NMC. I hope you can all see that from the screen, and I'm going to read it out to you. If you don't have the Osce, the mock if you don't have the mock material, you can have it on the website, that is the NMC Osce materials website. You just enter Osce materials on Google and it should pop up. I'm always going to follow the mock, and I'm always going to follow the marking criteria, because that should be your guide in order for you to pass your examination. If you want to pass your examination, you don't follow the guide, you follow some kind of tutorial which does not have a guide, man, you're gonna fail your exams. So let's just see. So I'm going to read it out to you, and I hope we understand certain keywords that we need to fish out if we are given the scenario. So you are working on the labor ward, and you've been asked to assist with the care of Helen, who gave birth to her second baby 6 hours ago. Helen and her baby are fit and well postnatally, and Helen would like an early postnatal discharge home. You have been asked to perform the systematic examination of the newborn prior to Helen's discharge home. The midwife caring for Helen informs you of Helen's clinical history as follows. Helen opted to have full antenatal screening for fetal anomaly scan at 16 weeks, which were reported to be low risk. Helen, at 20 weeks, opted to have fetal anomaly scan, where the nuchal fold was reported to be 6 millimeters with no further anomalies noted. Helen declined further follow-up. Helen was admitted in spontaneous labor and was in labor for 7 hours. Helen had had uncomplicated vaginal delivery of a live male infant. No resuscitation was required at birth. An examination of the infant at birth was performed, and no abnormalities were detected. How amazing is this? Here is the instruction. Please undertake a systematic examination of the newborn, focusing on the newborn guidance examination of the, and it is stated into bracket, examiner will select only one key area in the live assessment. That is the eyes, the heart, the hip, or the testes. So the examiner is going to ask you which of them, it's not even going to ask you, the examiner is going to give you to focus on one of these. Please verbalize and demonstrate your actions as you examine the newborn, giving full consideration of evidence-based practice and newborn guidance. The newborn infant examination offers opportunity, blah, blah, blah. Please note that you have 30 minutes in total to perform a pair of linked skill station. It will be up to you to plan your time, but this station is no longer one of the pair. The examiner will be warning you 5 minutes before the end. NMC is never going to trick you. This is a scenario. It doesn't necessarily mean that you're going to meet the exact thing at the examination hall. This is more of a practice. So you have a very nice scenario. What is expected of you when you listen to this history of the mother, who is called Helen? As it is written below, that 30 minutes is required, and it's no longer a length pair. So that means that this time, the 30 minutes, you are going to have 2 examinations to be done. It's going to be a birth or postnatal plus one of these. You are not going to do just a single one for just 30 minutes. That's going to be too much of time. So they give you the 2. However, you can either start the newborn examination before you do the others, or you do the others before you do the newborn examination. Either which, 30 minutes is allocated. Now let's fish out the keywords that one needs to keep in head anytime you are doing a newborn examination. There is something interesting about this history, and that it says that Helen opted for a full screening test at 16 weeks. So she had a full anomaly test done on screening done at 16 weeks, and it was low risk. So that means that we are dealing with a low risk mother, right? and we are not so concerned about so many things. Now let's move on to another thing. Mom was low risk at 16 weeks. Let's see if mom was low risk at 20 weeks. It says that at 20 weeks, Helen opted to have a fetal anomaly scan, where the nuchal fold were reported to be 6 millimeters with no anomalies noted. Now, a nuchal fold is something suspicious. A baby with a nuchal fold, what is coming in mind? I could be thinking of, should I be thinking of spinal bifida or any spinal defect? Yes, you should be thinking about spinal defect. So at this point, if mom was 60 weeks and low risk, this time at 20 weeks, we've already noted that there is a nuchal fold which was 6 millimeters. This is a reason for me to perform my Nipe, or this is a reason for me to perform my newborn examination. And I will be thinking about probably a referral need to be done. But well, let's see what happens next. Helen declined further follow-up. So that means that Helen has had her wonderful baby, but we don't know whether this nuchal fold resolved, it reduced in size, or it increased in size. So you've been asked to do an examination. You should never omit this particular nuchal fold 6 centimeters out. Either than that, you are going to fail. This is a hint for you to know that no, this has to fish somewhere in my proforma. I'm going to show you how a proforma looks like for the newborn examination. So this is how the proforma looks like for the newborn. So as we can all see over here, it is already enlisted with some keywords that is required of you. So let's say the head, it has the head column, the chest column, the organs, the abdomen, excretion, the legs, extremities, the heart, all those things. So you just, when you do your examination, you're just gonna fill in all these details. Assuming that you've probably done the birth examination or you've done your postnatal examination. So the second one is the newborn examination. You've already done it. So let's move on to the newborn. Before you check the newborn, you still need to assess for scene for safety. Just as we did in our assessment station, the 3 things we have to look out for: safety, privacy, and your hand hygiene. Just because you've done one station and moving on to the next station, probably they've asked if the baby is just by the mom. So you're already in your PPEs, which you use for the examination, or the birth skills for the mom. You're just going to move that same thing. No, you need to take off the PPEs, which you use for the mother, and don a new PPE before you move on to the baby. You need to gain consent from the mother to expose the baby. The privacy aspect is too. This time you are providing privacy to the newborn, and you're also going to provide warmth. The examiner will be watching you how you provide your warmth for the newborn. Then we move on to the scene for safety. As you approach the baby, what are you looking out for? This time you're not going to look on the floor, probably looking for a cowbell on the floor. No, you have to focus on the cot. How is baby lying in the cot? Are there any toys in the cot? Is baby covered well? These are the safety things you need to look out for. Is baby lying on the back? Is baby feet towards the end of the cot? Has mom placed some toys? Probably no. Most mom, when you have a baby, you want to keep baby calm. You feel like baby is going to love the toys. No. These things are things that can probably drop on baby's nose, and baby's gonna suffocate, and it might end up to sudden infant death syndrome, which we've all heard about it. We want to prevent that. We are not going to have anything in the cot. If the cot is rocking, probably mom was trying to comfort baby in the cot. It doesn't make it safety. You are supposed to seek consent from the mother that the examination will require the baby to be in a static mode, so the rocking effect of the cot is going to be changed. So you are going to move the cot, adjust it to become more stable and more steady, rather than it rocking to and fro or back and front. I hope this makes sense. So you've done your 3 things: privacy, safety, and your hand hygiene. You have to don your PPEs and you wear your gloves and your apron. After, you seek consent, as I mentioned earlier on. Take off baby's clothing and wrap baby with the cloth, because although you are going to do a systematic examination where you need the newborn to be naked, you still need to make sure that you are providing warmth. Irrespective whether it's a real baby or a dummy, please ensure you are providing warmth. Let's move on to, as you've provided your warmth, baby is exposed, just left with the head. What are the things you need to look out for? We need to look out for the suture lines, the fontanels, the anterior fontanels, which should be in a diamond shape, posterior fontanel, which should be in a triangular shape. You check the ears, the symmetry, the mouth, the nose, the eyes. Because the examination said focus on the eyes, this time you now have to educate the mother and the examiner. So this is how I will communicate with Helen if I'm to take Helen through the eyes. Hello Helen, as I mentioned earlier on, as I'm doing the systematic examination of the newborn, I'll also be focusing on the eyes. Now, the eyes is a screening test that I'm going to do for your newborn, and this is to identify and refer if baby was born with any congenital abnormality of the eyes. This is to help reduce morbidity and mortality in all newborn. I hope that is okay with you. Now, as I'm doing this examination right now, the examination will also be repeated 6 to 8 weeks by your GP. I hope that makes sense. I move on. How am I going to do this examination? It's going to be very simple. It's not going to be anything invasive. That is a way to reassure your mother. I will only be looking out for, most importantly, the red reflex of the newborn. I'm going to check if baby has a red reflex, a partial red reflex, or no reflex at all. I know you are wondering what a red reflex could be and what is that the midwife is checking on my baby. This is a better explanation. Usually at night, if you are to take picture with your phone with the flashlight, you realize that when you take a picture with the flashlight, your eyes color changes to red. So irrespective of if mother is having a hazel eye color, a green eye color, black eye color, brown eye color, when you take a picture at night with a flashlight, it emits that red thing and it looks like your eyes is looking red, which is already showing on the screen. That is what we call a red reflex. So I'll also be looking out for other any peculiar discharge, which is not looking like tears obviously, or the color of the eyes, the symmetry, equality, any edema, anything abnormal. I hope that is okay with you. Now, if I identify anything suspicious, you are not to worry. I will do a further referral to the pediatrician. Should the results come out positive, usually what we do is we do another referral to the ophthalmologist within 2 weeks for examination. I hope that makes sense. So I'm going to use my ophthalmoscope to check for baby's reflex. Because you have already explained to the mother and the examiner is pleased to give you values if it is a dummy. If it's an actual baby, then obviously you are going to see if there is a red reflex, yes or not. I hope that makes sense. So you are done with your eye, you focus on your eye, you've given the examiner and the mother what the screening test is about, how the screening test is done, when the screening test is done, and you've given what if is positive and what if is negative. You've already explained this. This scores you and this gives you your mark. You have to also focus on other parts of the body. So you talk about the nose, you'll be checking out for nasal flaring, you'll be checking out for the mouth, if the patency, if there's any cleft palate. You'll be checking the neck, you palpate the neck for swelling, you check the shoulders, equality, the clavicle, if there's any fracture, if there's any movement. You also check the chest, so you check for the intercostal recession, which most of us will call it chest indrawing. You check the breathing of the baby, you palpate the abdomen for swelling of the organs. You also check the cord. Is the cord looking dry? Is the cord separated? Is the cord bleeding? Is the cord discharging? You also check baby's nappy. You check baby's genitals. Has baby made a poo? What is the color of the poo? What of patency of the baby? If baby has already made a poo, that shows that the anus is patent. You can also inquire from the mother, how many times has baby changed the nappy? When you ask the number of times baby has changed the nappy, you are trying to give yourself the idea how mother is feeding baby. You also check about the equality of the hands and feet, the jidit. You need to count the jidit of the baby. 1 2 3 4 5. 1 2 3 4 5. I can confirm I have the right digit to check. Then you move on to the legs. You count 1 2 3 4 5. 1 2 3 4 5. You check the knees. You check the hip. Now you check the hip. You have to do the maneuvers. That is the Otolani maneuver and the Balus maneuver. Now these two examinations, when we talk about the hip or when we focus on the hip, we will dive more into what it means. In a sense that, I hope this video, as we are focusing on the eyes, we are not going to pay much attention. We also move on to, you move the baby towards the back. You have a feel of the baby's vertebral column. Now this baby already has a nuchal fold, which we do not know whether it's resolved, did it resolve, or has increased in size. So the back is very important. Since it is a dummy, the examiner is going to confirm with you if you had the examination of the back and still you can feel a nuchal fold. If you feel a nuchal fold, the examiner will tell you, yes, there is a nuchal fold, and it's obvious. So then you have to explain to the patient, okay, Helen, as per your history, you had a 20 weeks examination anomaly scan done for your baby, and it was detected that baby had a nuchal fold, which was about 6 millimeters. You didn't have any further screening tests done. Hope that is true. Now, as I did the examination of your back, I had a feel of the symmetry. I can still have a feel of a bit of a nuchal fold. You are not to so much be stressed about this. It's good we've actually detected it. We are going to do a referral to the pediatrician and a possible referral for an ultrasound scan to be done, just to see what exactly is going on. I hope that is okay with you. Then you are done. So you always need to pay attention of the history and the scenario that is given to you. Every word in the scenario is telling a story. If you omit, you might not know, you might fail. So please make sure that if you are given the scenario and they ask you, do you understand? Is it okay for you to start? You don't just rush and be like, okay, when they tell me I'm gonna do eyes, since you already know the eyes, you already know the heart, you already know the hip, you are ready to start. You didn't focus on the scenario, what the scenario was saying. It could even be that all other things are normal, but there are something fishy that will still require a referral to the pediatrician. Also, supposedly my examiner might have told me that there was a red reflex. Everything about the eyes was normal. Everything about the newborn is normal. What are you going to do? I'm still going to make a referral because of the nuchal fold. I hope that makes sense. Yes. So you are done with your examination. You've also talked to the mother about the eyes. After that, you need to dress your baby up and discard your PPEs in the infectious waste bin. After you are done, you need to give education to the mother. Usually there are 5 educations that I always explain to people, or I always explain to my candidate that these are very good information to share with the mother. and it's a very good education and a health promotion topic as well. In our video, we are going to talk about these 5 important education that I always advise people to educate their mothers on after your newborn examination. When you look at the newborn pro forma, there is a slot where it asks you to write the parental participation and health promotion points. You are supposed to write all the education you verbally explained to mother when you were doing the newborn examination. So when we move on to our next video, as we dive more into those education and what you can tell the mother, then you can fish in those things. Since my scenario was talking about a nuchal fold, there is another slot over here that talks about referral. Yes, if you have one of these, there's no need for me to show this on the screen, but so I'm gonna show it on the screen. So referral required, you have to write yes, referral to a pediatrician, referral date today. So the examination will probably say today, assume it is today. That is going to be your time of examination, and it's going to state the time. Referral completed by your full name, and you sign. Before you start writing on your pro forma during the examination, never forget to write your name and sign first. Please, even if there is no slot to write your name, find somewhere to write your name and sign. No matter how hard you've learned, there is always an aspect of anxiety you're gonna feel. You can forget to write your name if time is running out. Is that easy to forget? Is that easy to sign? In order to pass, you may not know, probably what you've written might even pass you, but because you didn't write your name and also sign alongside, then you are going to fail automatically, because we don't know who did that report writing or who did that record making. So it's enough for the examiner to fail you. Never fall victim of this. Please, when you are giving the scenario and you are starting, before you write anything on any sheet of paper given to you, just make sure you print your name and you sign alongside. I hope this makes sense. So a recap of what we've all talked about. As I said, during the examination of the newborn, it's a systematic examination that you have to do from head to toe of the newborn. After you are done with the examination of the newborn, the examiner asks you, or even before you start your examination, the examiner asks you to focus on one of these 4 things, which is the eyes, the heart, the hip, and the testes. If you are given the eyes, there are 4 things you need to keep in mind, and that is what the examination is about, when the examination is done, how the examination is carried out, and what if the examination shows a positive screening test. What do you do when there is a negative screening test? What do you do? What is the examination? It's a screening test to identify and refer all newborns born with congenital abnormality of the eyes, and this is to reduce morbidity and mortality. When is the examination done? It's done within first 72 hours of birth and also repeated 6 to 8 weeks by the GP. How is the examination carried? It focuses on red reflex to rule out congenital cataract. Now, it also checks the color, the symmetry, discharges, or anything abnormal that the eyes may be exhibiting. What if? What if there is a negative screening test? As mentioned earlier, the examination is repeated again 6 to 8 weeks by the GP. What if there is a positive screening test? You refer to the pediatrician, and if there is a positive screening test, you have to do another referral to the ophthalmologist within 2 weeks for examination. I hope this makes sense, and I hope this video has been extremely helpful. I know it's a lot to take in. Please do not worry. As you keep practicing, you just be there talking to yourself. And what is much important is your verbalization, how you are going to communicate with the patient and the examiner if you are asked to talk about the eyes, the heart, the hips, and the testes. Irrespective, never forget that before you start your documentation, you need to print your name and sign. I hope this video has been helpful, and thank you to all those who keep encouraging me and encouraging us to make more videos. I hope I am able to make more videos for you, and please share the videos. You can share with your friends. You can even have a group discussion. Play my videos, see how I talk about or explain certain things. And those who have passed their Osce, please give us a comment section. Let's see how the examination went. Was my video helpful? Just anything. Thank you and bye.